Hello, so today I've decided to do my presentation on chapter 22. This is about the conditions manifesting in the respiratory system. So there are a wide range of conditions, but I have hit on some of the main ones, and I also went over some of the anatomy for the respiratory system. Okay, so the respiratory system is easily exposed to infectious agents. So if you consider how much debris and pathogens we breathe in on a daily basis, we are bound to get sick at one point in our lives. So the upper respiratory tract, this is your nasal mucosa, and they block pathogens. And you also have your nasal hairs. They also help to block pathogens. And when bacteria travels into your body, if they do get through that first line of defense of the respiratory tract, usually the acidity of your stomach will kill those pathogens. So then you have your lower respiratory tract. This is your trachea until it reaches your alveoli. So you have cilia that try to move the particles out of the tract. So you have your second and third line of defense. So complement actions in the lungs will protect against any invading pathogens. So this is the microbiome that your lungs harbor. It houses a large number of commensal microorganisms. Healthy lungs have an abundance of microorganisms, either good or bad. So I just put a little picture up here. So you have your normal lung microbiome. So you have your bacteroides, your fusobacteria. And I just think it's really interesting to look. So you have your alveolus. So I think that's really cool to see how the microbiome plays out in the lungs. Okay, so this is the first condition that I hit on, and this is the common cold. So this is probably the most common infection you'll see. It's also called rhinitis. Sometimes it can occur twice a year for people, or even more. So symptoms you normally see in this is coughing or sneezing. Some people can experience low-grade fevers. That's usually seen more commonly in children. Also, if you have asthma, it's going to trigger those symptoms even more. So you have to be more aware of those symptoms so you do not trigger any asthma attack or anything else like that. So the virus actually has never been identified and its cause is unknown. But the symptoms are usually present because our body's trying to fight off the invader. So a fever or pain is usually because our body's trying to protect us from those pathogens. So usually it's spread by droplet contact. And for the treatment there is no vaccine. So usually you let it run its course. It usually lasts like 3 days to a week. And a way to stop the spread of this is to reduce the transmission. So cough in your elbow, wash your hands, and that kind of thing. So the next one I hit on is acute otitis media. So this is your average ear infection. So this can also occur in people that have the cold. What happens is there's a buildup of fluid in the middle ear that leads to bacterial multiplication and eventually leads to the inflammatory response. So sometimes this condition can get so severe that you can experience dizziness or confusion. So some signs and symptoms, it's usually painful. It can cause dizziness, hearing loss, or rupture of your eardrum if it gets too out of hand. And the reason the it's usually caused by many funguses and viruses. It's not communicable, and children are very susceptible to getting this condition. So next, I hit on pharyngitis. So this is inflammation of the throat. This can occur with uh, many different conditions, usually strep. There are different severities of pain. I thought this was interesting that sore throats caused by bacteria are more painful than viruses. And usually you see reddened mucosa, swollen tonsils, and inflammatory products. So, if you leave this untreated, it can cause major complications and even conditions as far as 3 years later. So it's usually spread by droplet or direct contact. It's pretty spreadable. It is less infectious via fomites, and there are no vaccine for streptococcal group A. So the next one is whooping cough. It's also known as pertussis. There is a vaccine available. So the reason whooping cough gets its name is because the frequent coughing as someone tries to catch their breath, that's kind of what makes the whooping sound. During the convalescent stage, you are more susceptible to getting another virus because you are immunocompromised. So if you cough, if you think about it, somebody who's coughing too much, it can lead to burst blood vessels or vomiting or even seizures. So what happens to get this virus is bacterium attached to epithelium cells in your mouth, and then it increases in very large numbers. So it starts with cold symptoms before leading to coughing, and yeah, it's extremely dangerous because between each cough you cannot catch your breath. So okay, so the next one is influenza, also known as the flu. So this usually occurs yearly. People are more susceptible to get this during the time it's most prominent, so different seasons such as like the fall or winter. It can turn deadly if it gets out of hand, and usually it acts differently than other viruses. You have different strains of the flu. It can lead to several conditions, one being pneumonia. So usually if you have the flu, usually people in healthcare, if they have the flu, you can see them having pneumonia because they're immunocompromised. So I put this, prevent the spread of the flu and avoid contact with sick people because it's spread by droplet or contact. If you have flu-like symptoms, stay home until 24 hours after symptoms disappear. Um, Disinfect surfaces and wash your hands. Avoid touching your eyes, nose, and mouth. And cover your mouth when you cough and sneeze. So the next one is tuberculosis. This is an ancient human disease, and usually people, only 5 to 10% of people get symptoms, clinical symptoms, if they have this condition. So if this gets out of hand, some bacteria can escape the lungs and enter into the lymphatic system or the blood system. So okay, so the next one, multi-drug resistant tuberculosis. So This is a strain of tuberculosis that's resistant to isoniazid and rifampin. So it requires 18 to 24 month treatment with 4 to 6 drugs to get over this condition. So people who present with this are more sick and have higher mortality rates. And the current recommended drugs are pretomanid, bequeliline, and linezolid. And it's a very dangerous condition. So next, we have pneumonia. So this is an inflammatory condition in the lungs. You usually see it with older people, and it is usually common with someone who's immunocompromised. So if they have one disease or condition, they usually get pneumonia. So this can be very deadly if not treated. So usually some symptoms you can see, especially in elderly people, is confusion. You can see thick colored sputum, yellow sputum. You see coughing. You get flu-like symptoms like a fever, and you can run a big temperature with it. Okay, so next is community-acquired pneumonia. So this is pneumonia that is spread through the community through droplet or contact. So there are different diagnoses that those that acquire it in healthier settings. In many cases, the pathogen was unable to be detected. And during COVID-19, any pneumonia could mess up the COVID test. So next is Streptococcus pneumoniae. This is a form of pneumonia. So this is a condition where the normal biota of the upper respiratory tract inhale people. Infection can occur when bacteria is inhaled into the deep areas of the lungs. It usually has a short survival time, and age, season, and any underlying conditions or causes. So, like I said before, usually you can see pneumonia through age or season. Okay, so the next one is Mycoplasma pneumonia. So these symptoms are different. They resemble symptoms of the cold, but usually more severe. So this is the accumulation of mucus in the lungs, and it is transmitted through droplets. So all of these are strains of pneumonia, but they affect people differently, and they have different treatments and different pathophysiologies. So this one is extremely dangerous because of the accumulation of mucus in the lungs. You can have lung collapse or anything of that sort, so you have to be careful with that. So lastly, you have Histoplasma capsulatum. So I recently studied this one. So it has affected humans since ancient times. Can cause many manifestations, some being lesions. I thought that was interesting. Flourishes within cells and spread very quickly. So the symptoms can range from mild to severe, and it usually occurs with AIDS. So I thought that was an interesting topic. But many of these diseases have affected humans since ancient times that I've went over, and our technology has improved to where we can have different vaccines to fight off these conditions.